Now we have a great lineup to finish. First up, we've got Dr. Justine Camp. So she's Associate Dean Māori for Dunedin School of Medicine, and she's co-director of the EDOR Centre. Lots of co-directors. I think there's 17 at last count. No, there's only 4. Anyway, Justine she's the Maori lead on Moi Moi A, the Maori-led sleep project we've been hearing about, and co-PI on the Aotearoa Direct trial as well, which we've also been hearing about. So, Justine, the floor is yours. Kia ora.
O tēnā tātou katoa, katu tēnā ki te mihi atu ki a koutou, aha ko he mihi tino pōpoto, nā te mihi he tino iti te wā mō tēnei kōrero. So kia ora everyone. I had COVID a couple of weeks ago and still have the cough, so if I exit stage left and my daughter comes up, she's just going to finish the kōrero, or should I start choking? And I too are very, very depressed after reading some media stuff today. But feeling a bit more heartened after having a chat with Barry, who tells me all our stuff's gonna hold up under the spotlight. So yay. So today I'm just going to quickly talk about this notion of he te ara whakapiki. So another is a pathway, and so we're sort of moving into our next pathway for the next 20 years. Whakapiki is to uplift, and we've been undertaking a strategic refresh, so don't ask me questions about it, because at the very end of the session Rachel's actually going to unveil where we've got to. But as someone who is grounded in my community, in my hapu, in my iwi, in my whānau, I didn't want to be the sole voice for that, and so we undertook some consultation, and I'm just going to quickly outline what the community were after. Normally I'd always got our Māori med students in the house, tell all our presenters that your mihi doesn't count on time, but it will, so I'm just going to leave it up there. It makes no real sense to a lot of people, I'm sure, but I think the reason it's really, really important to ground myself in who I am is that my whakapapa actually connects me to EDOR. So you saw the original board had my mum's older sister on, or my auntie Eleanor, and she was probably the first to undertake some community partnership research with Jim. My grandfather, my mother's father, and my auntie's father was one of 16 children, and all 15 of them died from the complications of type 2 diabetes. My father was diagnosed with type 1 diabetes at the age of 11, and he lived till he's 72. So, and Jim was his doctor, so they must have done something not bad together for him to live that long. And so I guess that's partly why I'm here. We're going for an intergenerational, longitudinal approach to solving some issues for our communities who live with type 2 diabetes, obesity-related issues, communicable diseases, etc. I always start with my why. A lot of people think he's my son, but he's actually my grandson. So Rachel was saying something that she was doing in 1995. I was giving birth to this lovely young lady over here, and for some silly reason she followed in my footsteps, and she gave birth youngish too. And so Tamarokut is up the back. He's not very happy with the previous session because it's talking about limiting screen time and his access to McDonald's. So he's ready to go home. But this is my why. So I'm going to start introducing this notion of a pathway forward, and here we have the start of that pathway. So on the few slides coming, we've got some posts that are starting to line up on that pathway, and these are ones that we've identified as a result of, I think, the last 6 years, plus actually the last 20 years of engaging with those Māori communities, starting with Ngāti and Healthy, and the Ahua Noho Living Well with Diabetes project. We've also been working a lot with providers, so our MOST and many of our other projects actually work directly with those providers and those people on the ground as well as other researchers across the country. This year we've begun to engage specifically on our Māori community aspirations for the future of EDOR. And we've identified 4 pau or posts that will be placed upon our pathway. So just a pretty example of some posts on the pathway. So the first one, as it probably always will be with any community, is that idea of self-determination. And so tino rangatiratanga. So it's not just a movement where people rock up with flags and protests. It's actually a practice, and it's living accord to our values, striving wherever possible to ensure that our communities are healthy, well-educated, and can live a good life. Whānau, in our consultation, we're very clear that this principle and the incorporation of it is essential to realising the promises made by the treaty, assuming we still have one in 3 years, and to fulfilling the aspirations laid down by our tupuna when signing it. So, what is coming in front of us? As you can see, for the last 20 years, EDOR's been working really hard to fill in this pathway. The second pau are Māori solutions, by Māori, with Māori and for Māori. So we're certainly not going to do this whole separatist thing that we constantly get accused of. We know that research and partnership in research produces best outcomes. So Jill talked earlier about trying to blend mātauranga Māori with most. And it was an interesting and quite fun time, and at times quite frustrating. So we've always sort of come up with this idea of we want outcomes, not just outputs. Should the data always drive the research, or should the outcomes drive it? So they are some of the, I think, useful conversations that we've been undertaking for a few years now. Whānau were clear that while it's really helpful to have information translated into multiple languages, that in itself is not necessarily a solution for the problems that are quite unique. So they want Māori solutions as well as all our partnership stuff. And some examples of where we've partnered have been Moi Moi A. We're currently working with 6 communities around the country, from the Bluff right through to the far north, looking at working with families who live with heart disease and looking for how people live well with it. We know that the biomarkers for predicting heart disease amongst women are actually based on men's bodies, so we're trying to see if we can look for some more appropriate research and indicators around women's heart health. And our 2 Māori Me students, who I don't keep meaning to throw under the spotlight here, but they're just about to start a project where we're working with the Māori community in the hospital in Oamaru to start some development around Māori diabetes and cancer pathways. So they're just a couple of examples of some stuff we're up to. Draw a shape to create a screen snip? Nope. Can I just not touch anything? I don't know. The 4th post that we want to put on the pathway has been a whole of whānau approach. So while the person living with a particular illness absolutely carries that burden, so does the entire family. When one person in the family is ill, the whole family is affected. And we looked at research on that quite a long time ago. We are not individuals in a bubble, except we were in our COVID bubbles, and if you live by yourself, then of course you were. And while the family members, may not need the medications, we definitely need to be involved in the care of our loved ones. We think intergenerational approaches are important, so having that memory, having those layers are a really, really important way to tackling some of these things that we've been trying to tackle for a long time. And most importantly, those solutions need to work for those whānau. If whānau are to be whole, healthy, and they need to be connected. Moving into the natural world. Pretty picture. Good job, Bob. So natural world-based people want more green and blue prescriptions, I think is the best way to describe them. We know that a key driver of Māori, which is health and wellbeing, without the F word, flourishing, and therefore our natural world impacts on our health and wellbeing, and we also obviously have an impact on that natural world. We need a healthy environment to be healthy as people, so if our currently with our global warming, we've got a lot more rabbits, like in Central Otago, because our land's becoming drier. That means it gets harder to grow food, and we have to change the foods that we're growing. We're getting snapper down here in the south. We shouldn't be having snapper, and I don't know where our blue cod's going to go. We don't like snapper. So in order for us to be healthy, we know the environment has to be healthy. And we need solutions that essentially focus upon this. So, putting that detail in our ara, our research, our partnerships, and our aspirations. Sounds really cool. So I'm going to actually leave it there. I could waffle, but I have decided not to, because I think what's really, really important is that the community itself speaks, and that we don't just always hear about the research, but we actually hear about the realities and the impacts of living with diabetes and disease on real people. And so to that end, I'm going to go and let them have the floor.